The Virginia Cable Telecommunications Association and your local cable provider presents Cable Reports. Join us now as Cable Reports brings you up to date on current issues facing the Commonwealth through discussions with your local legislators and other policymakers from across Virginia.
Welcome to a special edition of Cable Reports, brought to you by the Virginia Cable Telecommunications Association, connecting Virginians to their government. We're really excited to have Dr. Michael Ryle with us today, Virginia Commonwealth University and VCU Health System President. Welcome, sir.
Thank you, Woody. It's good to be here.
You know, it's hard to believe that it's been, 177 years since VCU started as a regional medical school.
That's right.
And from there it became a commuter facility, but now it's one of the more renowned nationwide and internationally recognized research institutes.
Indeed.
Talk to us about that history and development.
Well, it's been an interesting journey that started out as a medical college, the medical department of Hampton-Sydney, as a matter of fact, and then became more independent as it became Medical College of Virginia, of which we are very, very proud in terms of our history. And then in 1968, the state had made the decision to merge the Medical College of Virginia and also the Richmond Professional Institute into Virginia Commonwealth University, with a vision that really plays out today. The vision was that this would become an institution that would be realistically the third big research university. And I think the vision was a good one, because what was happening at that time is that our country had one of the first surpluses, and many of our states did as well. They benefited from that. We particularly benefited from that in Virginia, given our proximity to Washington, D.C., and a number of things that were playing out at that time economically. And so to leverage a lot of that growth, it was important for Virginia to have another major research university, and that's exactly what's happened. And it's become increasingly important because when you look at what has happened across our country, it really is that our country has done well, where there have been centers of tremendous creativity and job creation. And I'm not just talking about job creation, I'm talking about employment at the higher end of the wage spectrum, which has become the way that cities become successful, and collectively our country becomes successful in a nation, in a world rather, that has become very competitive.
Well, talk to us about the diversity of your student body as well as your faculty and staff.
Well, that's one of the distinctions of VCU. So we are among the nation's research universities, and we're very proud of that. But one of the distinctions is that we're one of the most diverse student populations among the research universities. It's a source of great pride, because what I would say is that our student population really looks more like the future of the population of our country, and certainly of the population of Virginia. A lot of our students are coming from Northern Virginia. In fact, more than half are coming from Northern Virginia, which truly does look like the country as it emerges demographically. And so what that does is that really strengthens the learning environment. It gives our students a place in which they're learning with students who will be very much like the people with whom they will be working. So a physician, for an example, we're educating a student who might be getting her or his MD. They'll go through a residency program depending on what they end up deciding to do. And ultimately, they'll be working with patients who will be quite diverse and look much like our student population does, and much like the population of our patients at our hospitals.
Now, how difficult is it to attract and retain faculty and staff, especially in terms of competitive compensation?
It is a challenge. There is no question. It is not easy to attract top faculty. We've been able to do it very well. It is an amazing combination of lots of different factors. One is the extent to which the faculty that exists at the university reaches out and connects with faculty members in other places, or with even doctoral students who are studying to become professors. You are absolutely right. It is also difficult in our current climate to be as competitive with pay as we would like, but we have made that our top priority this year, and we're very grateful to the General Assembly and the Governor for their support of the salaries of our faculty members. We'll be awarding that in a meritorious way based on performance to make certain that the people who are at the top of their game are being rewarded appropriately. And eventually that becomes part of our own overall compensation plan, because with a faculty that truly is, and a staff for that matter, that truly is what comprises a major national research university, we have to be competitive in the nation, not just in Virginia. And so we'll be making sure that we can do that.
Now, what kind of graduation rates do you have?
Our graduation rate has driven up dramatically. So in just the last 4 or 5 years of our strategic plan, we started talking about our strategic plan about six years ago. And then we really did launch it about 5 years ago. And the strategic plan at that time called for us to really look at our graduation rate and to increase significantly the number of graduates at VCU, which we've been able to do. So in that time frame, it's been about an 8% increase, which we're very proud of. But we've also done some other things. We've tried to convince students to do the math, as we call it. And what that means is, does it really pay you to get through your educational program a lot more quickly, or does it pay you to extend it out? And the answer is, of course, it pays you to take as many credit hours as you possibly can and then finish your program within 4 years. And after all, as many say, that's why we're called four-year colleges, right? And so we do understand that some of the experiences that our students will have complementary to their classroom and laboratory experiences and studio and clinical experiences will help them be more competitive. But those can be fit into a four-year context. And so we're really pushing on that, trying to get our students to take as many credit hours as they can each year. And then, of course, we've taught them the time value of money, right?
Mm-hmm. Well, what about the rising cost of tuition? What is the university doing to ameliorate that?
We're doing everything we possibly can to keep the cost of tuition as low as possible. We are right in the neighborhood with our research university peers. We're all hoping to do that. I don't know of a research university that wants to raise tuition. If you talk to students and you get good counsel from them, particularly your student leadership, they always will tell you, make certain that you hang on to quality. Make certain that you continue to take steps forward in terms of making it a stronger experience for us so that we can be employed, so that we can be proud of the degree that we earn from you. And so we have that balance between being, if you will, frugal, and so frugal that you compromise quality and students don't like it, and of course being as inexpensive as you can possibly be. You noted earlier that compensation is a challenge. You're absolutely right, and that is one of the key drivers in terms of costs in higher education. We have more people who graduate from high school today than ever in the history of this country who expect to go to college, and we do expect them to go to college. So as time goes by, though, we really have to find a way to lead the curve in terms of trying to understand humans and how they learn, and trying to find less expensive ways to be certain that they can learn and get, if you will, certified or degreed, so that they're able to be successful as Americans, and hopefully in the long run it won't cost them as much as the escalations have suggested it could otherwise.
Now I understand you have a record number of freshmen now pursuing degrees?
We do. We have had large numbers of freshmen come in. We're also mindful of that ratio. That ratio between the number of students that we bring in and the number of faculty members that I have as colleagues who are there to teach them. But remember, it's about teaching, but it's about mentoring. It's about really trying to take what we ask our students to learn and have them emerge into, while they're students, emerge into the community using what they learn to help benefit other people. And you know, that's something that really is as much as parenting. I mean, you're talking about an enormous undertaking with folks who can learn, but you want them to remember what they're learning because they're looking at, they're using what they're learning, and they're able to understand the value of what they're learning. And that does take a lot more mentoring than it does just pure teaching, if you will.
So in loco parentis, for example.
in a sense.
You made a bold move recently, and that was to drop the requirement of SAT scores.
Well, to be clear, what we're doing is the SAT is an option for most students. In some areas it's not an option, but in some areas it is an option. And what that means realistically is that we don't want the SAT as a single factor to be a barrier to a student who can really perform and do well at a university, at a research university, including VCU. We have studied this issue at great length, and we have learned that the SAT is not as strong a predictor of how successful a student will be in an environment like ours. So you have to tell us that you're not going to use the SAT, okay. And then we are going to look very closely at several things. We'll look at your grade point average, we'll look at the school that you went to, we'll look at the courses that you took, we'll look at what you write. We may even want to talk with you in order to be certain. Ultimately, Woody, this is about making sure that students who come to Virginia Commonwealth University can and will be successful. There is no point in bringing students to any institution in which they can't be successful. The worst thing that can happen is a student enrolls at a university or a college, doesn't do well, and gets disenchanted by the whole idea of college. We want everybody to live the American dream by developing their human wares, their intellectual abilities, and to find the right place in society in which they're able to use what they learn and live a satisfied life as a Virginian, contributing back to Virginia.
Talk to us about your role in the international community, the university.
Well, for every research university for that matter, it's really important to be connected globally, because ultimately so many of the places where our students will go after they graduate will have international connections. A life that is not lived with the ability to truly benefit from people who are from all over the world is really a life that is not well lived. You know, we think this is something that's very important. So we have partners in places like China. We're in fact partnered with the two top institutions there. That number one and number two ranked in China, a nation of a tremendous number of people, and growing, by the way, and growing success economically. So that connection's important. We have another partnership in Spain with the University of Cordoba that's very important to us. It's also helpful because we have so much in terms of what we're looking at together in the areas of cancer and diabetes. We also have a partnership with an institution in South Africa and KwaZulu-Natal. We're very proud of that as well. And we'll continue to look for ways in which to partner, but very thoughtfully so that we're able to have a deep partnership with each of these institutions and not have anything that could be so superficial that our students won't be able to find a way to it.
Now I understand there was a recent visit to China and you were well received. The university was recognized there, if you will?
Yes, great observation. So we were in China visiting an institution, Fudan University, that we have had a partnership for a very long time. And as we were there, it was interesting. We visited some other institutions, including Peking University, which is the #1 ranked institution in Beijing. And they were able to tell us that we know how well ranked you are. In fact, they actually reminded us that we are one of the top 200 research universities in the world. So they were very pleased to partner with us, very pleased to work together with us. And so we continue those partnerships with the hope that our faculty members will pursue relationships with faculty members there, and so that our students will as well go to those institutions. And we will be counting students. We're interested, frankly, in having as many Chinese students come to our institution as possible. They bring tremendous benefit to the institution. Certainly they bring a tremendous cultural benefit to the institution. They also, I think, bring a real sense of resource as well. I mean, the truth is that these are students who pay considerably to be at a place like VCU, and that helps offset the costs that some of our students locally might otherwise be burdened with.
March Madness will be upon us shortly,
yes,
and hopefully your team will be back in the finals, perhaps. Yes. How important is it to the university to have an athletic team that's doing well?
It's very important if you just look at the landscape and you understand the mindset of most Americans. Most Americans come together around athletics. Whether any of us individually might like that or not, the reality is that most Americans do support athletics. If I can use athletics as a window through which Americans will look at VCU and support VCU, it's a great thing for us. So that when we went to the Final Four about 3 or 4 years ago, I guess it was now 4 years ago, I remember that the day after we finished and won in the Elite Eight, our student athletes won in the Elite Eight, we noticed that we had more than 11 million hits on the VCU website, not the athletics website. And so suddenly there was this tremendous interest in Virginia Commonwealth University, which is exactly what we wanted. The number of applications from very strong students and diverse students continued to rise. It really became an important part of the ways in which people looked at Virginia through VCU. So it also helped raise the profile of the state, for which we are proud as well.
Now, the university has also been recognized as an economic driver in the Richmond area, but also regionally. Talk to us about that.
There's no question that VCU is being looked at more and more as a regional economic driver. Downtown is our home. We're very, very proud of that. You know, our goal is to be a partner and a player in downtown. We certainly want to use some of our resources to do that. We cannot do it all. We hope to, through our students and our faculty members, our patients and their families, we are hoping that we will attract economic activity, that we will attract people from not only the suburbs, but from all over the country and certainly all over the state. Richmond is a wonderful place, and I'll never forget 6 years ago, actually 6.5 years ago, my very first drive down Broad Street. I was driving, and I'm looking around on Broad Street realizing there is so much potential here. And I began to really envision what could happen between our two campuses. And so we've begun to emerge with some of that. As you know, we were locating our police headquarters at the old United Way building. And so we will do some strategic things like that in places like along Broad Street and Gray Street, and certainly all over our medical center as well, as we extend our footprint there. But it will be important for everyone to realize that we'll be a partner. And hopefully our partners who come in will be partners that want to serve our students, who want to serve our faculty members and our patients and their families who are visiting patients as well.
Now, you've been here about 6 years now, but you've been very successful in terms of construction. Talk to us about some of those projects.
We've had an enormous amount of construction, and the real reason for that is that we are, among the research universities, we have the lowest number, the smallest number of square feet per student. And so our students, we tell them that one of the ways that we want them to learn is we need them to get together. So whether they're in dental school or whether they are freshmen in the focused inquiry program, they have to get together in groups outside of class. And we've got to give them spaces to do that. And so we are expanding our spaces. For instance, our library is under expansion thanks to the state, thanks to the governor and the General Assembly. We're very grateful for that. We'll outgrow it the minute the doors open because it's already so small. But we are expanding. Our Living Learning Village, which has really populated Gray Street, is a place where each part of that Living Learning Village, each facility, is realistically on the ground floor, sometimes opportunities for retail so that everyone can benefit from that, and we can keep the streetscape, if you will. We also put into those facilities on the ground floor a programmatic theme. So for one, it was community engagement. For another, it was global education. For the next one's coming, it will be leadership and innovation. And on top of that, you'll have people who commit themselves to that theme who live together in what we call apartment-style housing, which our students really like. So that's been a big project for us. Our children's pavilion right across the street from here is a very important project. We needed to have a really easy access point for outpatient services for our children. We have an enormous population of need, and we want their parents, who already have to deal with the issues that their children are dealing with, and those can often be stressful. We want to make it easy for them to park and easy for them to ride up an elevator and see the doctor or provider who will help the patient overcome, hopefully, the issue that they might be facing. So that facility will come online a little less than a year from now, actually. And of course, our library project will be at about the same timing. We have lots of other projects that we're in the middle of as well.
I think there's an art center.
Right. The Institute for Contemporary Art is a project that we envisioned, again, 6 years ago. It was a vision that really came together around people in this town who said, I'm really proud of Richmond. I'm proud that you have a #1 ranked public school of the arts, and I want to see Richmond become a destination for the arts community, the worldwide contemporary art community. And so that's what we'll do. It will be a destination for people, and it will bring more opportunity to Richmond. So that will be a facility that will be designed like nothing else you've ever seen in Richmond, but probably like not much else that you've seen in the country. So this is a really good opportunity for Richmond. It's a great opportunity for Virginia. It's a really important opportunity for our students and my faculty colleagues who really deserve to have a world-class, truly world-class facility on their campus where they have established our reputation as such a strong art school.
Well, let's shift gears for a second and talk to us about the medical facility and how critical and important that is to the region and to the city.
You know, we are, of course, the safety net. We're very proud of being the safety net, but I also want to remind you, we are the #1 ranked hospital as well. So I can tell you with great pride that if Virginia Commonwealth University Health System did not exist, if not for VCU Health, we would not have the care that we have in this community. It would be impossible because there are so many things in which we invest deeply that candidly cost us, but it's worth it because we know that we are fulfilling our mission of care to those who have the most complex issues and illnesses. There are a lot of comorbidities and issues that people deal with. They don't even understand what's happening, but they know they feel horrible. And that's part of our mission, is to be certain that we are the access point for anybody and everybody who has an issue, particularly those who we don't want to have to worry about, do I have insurance, or how am I going to pay for this? And at the same time, what's happening, Woody, is that you have a population whose care is provided by people who are learning to provide that care. And what we want to teach our students is empathy for all human beings. You know, it's important to understand the business. It's important to, you know, to be certain that you have the checks and balances and that sort of thing. But ultimately, for people who decide to go into health and commit their lives to the health of other people, we want them to be compassionate and empathetic. We want them to take care of people and do it in the best possible ways. And we provide that environment. We also need to be the place that understands the causes and cures. So we are committed to understanding why things happen that affect people in negative ways in their health. And also we need to find the cures. And so my colleagues, physician scientists and scientists across the street, are committed day in and day out to understanding what's going on, but also finding ways to cure diseases that affect human lives in horrible ways, including death. So our job is to save lives. Our job is to improve lives. Our job is to educate the next generation of leaders who will do more of the same. And of course, our job is ultimately to be a significant resource to this state, socially, economically, emotionally, and in every other way. We need Virginia to be the strongest state that it can possibly be, and we are going to lead the curve in terms of higher education being a model to help ensure that as a foundation.
Now, an important aspect of your leadership is continuing to distinguish this university from others.
Yes, sir.
Tell us what you're doing in that regard.
So the distinctions for Virginia Commonwealth University are that as a major research university, we of course have a not an overwhelming in size, but significant downtown environment. That's a great place to learn. And we are continuing to do our part as a major part of the city to improve and strengthen it. We also think it's important that we have one of the most diverse student populations in the country. We certainly do among the four-year institutions in the state. That makes for a great learning environment as well. And it of course makes for an environment in which you send the message out to a population that looks more like our students that this is a place for you. And that's an important social concept as well. We are accessible. We will not block you because of a single point of view. You know, the SAT was one example of that. If you have other ways in which you can demonstrate to us that you can be successful, that you're motivated, you'll work hard, you're committed to being a leader in your field, you're committed to being the best in your field, and you're committed to shaping and engaging society in your discipline, then we're interested in you. Finally, I would say our research is a brand that's very different. We call it Make It Real. And so what I'm saying is that our research has an immediate value to the people who can benefit from it. There are some things that we're doing that are very basic, that have a long-term horizon, but most of what we're doing, most of my colleagues are doing research that has an immediate benefit to a population in need right now that's confirmed. So, you know, I have a lot of examples I could give you, but one great example is all of my colleagues who are trauma surgeons. You know, we see the most unbelievable of trauma cases, and you see our ads all the time where we've been able to save a life of someone who was in a terrible situation, not of their own doing oftentimes. But our trauma surgeons are committed to sending very strong communications out about things like not texting when you're driving. And that's their current campaign. You know, more than half of the cases that we see are auto-related accidents, where, frankly, an accident is an accident. It didn't happen on purpose. It happened because it was an accident. Was it preventable? The answer is oftentimes yes. And sometimes it's because of distractions. And so our trauma surgeons look at the people who come through the door and they say, how can we prevent that? They also look at violence cases and they say, how can we prevent that? And so, you know, that's again just one example of a way in which a set of my colleagues are committed to improving society and making real everything that they do today, tomorrow.
Now, we've got about a minute and a half left,
Yes,
but
sir.
I wanted you to comment on public safety on college campuses, because
Yes,
I know you and your police chief are using new technologies to
Yes, sir.
deal with those issues.
So, right, I, number one, did the best thing I could, which was my very first hire was Chief Venuti, one of our superstars, not only in Virginia, but in this country. He has just been an incredible partner. He has taken all of my serious concerns relative to safety very seriously. He asked me for resources to support a project that he was convinced would make a significant difference in terms of our ability to, frankly, get to the truth about what happens in safety cases. And so we installed technology and video, and it's made a huge difference.
Great. Well, thank you so much for taking the time to be with us.
It's my pleasure.
President
Thank you.
Michael Rao.
Thank you for having me.
Thank you for watching this special edition of Cable Reports, brought to you by the Virginia Cable Telecommunications Association, connecting Virginians to their government. Until next time, I'm Woody Evans.
Mm-hmm.